Welcome to this module on translating the evidence. This is where the rubber hits the road, as the saying goes. Even the best evidence only makes a difference when applied well. Let's look together at some strategies for best translation. What do we mean by translation? The National Institutes of Health National Center for Advancing Translational Sciences shares the definition that translation is the process of turning observations in the laboratory, clinic, and community into interventions that improve the health of individuals and the public, from diagnostics and therapeutics to medical procedures and behavioral changes. Practically speaking, it's moving the best evidence into our professional practices. What is the purpose of translation? The goals. We're all about the best outcomes, first for our clients and then for our team and organization. Best outcomes also involve lower risk. Are we meeting safety goals, privacy standards, reducing incidence rates? Are we creating the best value? Yes, we need things to be cost-effective as well. This benefits clients, the team, and organization. But value also means that clients and team members find the methods acceptable and meaningful. More broadly, we're talking about the quality improvement process. Best evidence is translated to improve quality. Beyond the definitions and goals, it can be helpful to see the big picture or the whole process before we look at the details. Don't panic. You may not be a framework kind of person, but stay with me. We're using the knowledge to action framework to give us an awareness of the process of translation. An orderly process can help us avoid oversights that can hijack our success and outcomes. We start in the middle with knowledge. That's the evidence. You have been reviewing how to find and appraise that evidence in previous modules. We'll look together at each step in the outer circle or cycle with practical tips and strategies that you can apply. You may not have studied or used the knowledge to action framework specifically, but you have seen or used similar processes. The most basic steps of the knowledge to action framework are shown in the bulleted items. Have you used the PDSA improvement cycle? This cycle is used very commonly in quality, process, and performance improvement efforts within organizations. Both of these frameworks or processes are aligned in this graphic. Each of these processes apply to translating evidence, and they all have similarities. They are all cycles, meaning that you repeat the steps as needed to keep best practices and outcomes evolving. Even if we find the perfect solution and plan for now, the situations change and we'll need to reevaluate and adjust. Okay, here's another familiar topic for public health team members. Tracking complex processes can be a challenge. All organizations and teams have a level of complexity, and healthcare is especially complicated. We need to plan for our translation to include really effective communication and documentation. What's the old saying? If you didn't document it, you didn't do it. We may want to roll our eyes, groan, or wish there wasn't so much documenting to do. But the fact remains we must communicate with a large team, often in multiple locations and on multiple schedules. Without documentation and other effective tools for communication, our actions will be chaotic and our goals unrealized. We need to be engaging and relational, approachable and accurate. Look around for resources that can help you, including published toolkits or organizational tools and resources. We have provided a process worksheet on this site that can be printed and used as well. Let's jump right into the first step of the process, identifying a problem. We're all pretty familiar with the quality benchmarks and indicators that are part of public health. Regulation, accreditation, and funding are all based on indicators of quality and outcomes. But even without these reasons, careful assessment and data analysis is needed for objective decisions and best outcomes for each client or population. It seems self-explanatory, but some examples may help. Much of the time, the process starts with irritations and questions that arise in daily practice. Something is inefficient and causing frustration for clients or staff. Someone makes a suggestion that takes us by surprise or intrigues us. Or our organization or department may have already identified some goals that we can link into. Ideally, we could be looking beyond our own environment for new ideas and advances. Engaging in professional organizations, conferences, and journals or journal clubs can help us stay current in the evidence base and best practices. When a topic or problem has been identified, the next step is to assemble a team. A team can be helpful even before the topic is chosen, but additional members may be needed based on the topic that is finally selected. More heads and more hands makes the work more doable. The time constraints and complexity of most environments require sharing the workload and expertise. Think of all the types of expertise that might be needed. Who is impacted and what can they contribute? Involving people from related disciplines and roles helps to avoid barriers, gain resources, and share the responsibilities. Important team members include providers and nurses to provide clinical expertise, therapists, pharmacists, and other clinical team members, leadership to provide organizational perspectives and resource guidance, educators to help with communication, quality specialists to help with measurement and change processes, technology experts to incorporate helpful tools. Don't forget client or customer input. Solutions are no good if they don't work for all the beneficiaries. Of course, teams require good communication to work well, but it's worth it. In earlier modules, you learned about searching for and appraising evidence. A team can help with this as well to speed and sharpen the process. After finding the best sources of evidence, you and your team will need to summarize. What is the most valid, reliable, applicable, and meaningful evidence for use in your environment? Make sure you have considered your current standards and assessed your current situation. Identify new research and ideas, regulatory requirements, professional guidelines from reliable sources, and your own context and client values. Here's another word picture to stick in your memory. Making plans to solve a problem without the best evidence and indications for success is like throwing spaghetti at a wall. Some may stick, but most of it will fall in a pile that isn't useful and makes a mess. Even what sticks probably isn't pretty. Greater successes are achieved more quickly when we plan carefully using evidence that has already been demonstrated as helpful in other instances. Clarity is a good thing. With your evidence base now in hand, set some SMART goals. This level of detail communicates a specific focus for the whole project team. The goal statement should clearly identify the specific problem, state baseline measurements, and set targets for improvement. Reflect realistic and attainable expectations, and state a timeline for the project. Here are a couple of examples. Within 3 months, we will design a vaccination process for mobile clinics that ensures access to at least 50 members of the target population per day. Does this goal meet all the SMART elements? Is it specific, measurable, attainable, realistic, and time-based? What do you think? While there's a good bit of clarity and detail included, you may see the need for more. What type of vaccination? How long is the clinic open? This goal could be more specific and measurable. Here's another example. Within 6 months, we will increase the percentage of clients who receive education about the risks of high blood pressure. Does this goal meet all the SMART elements? Is it specific, measurable, attainable, realistic, and time-based? What is the specific target population? How many clients define a significant increase? Take your best shot at revising these goals or stating your own goal. You're ready to develop a plan for action. Remember the PDSA process we mentioned earlier? This is where we begin translating the evidence. Take the evidence you have summarized and develop the details needed for implementation. Write or revise standards and processes for reference and consistency. These may be used for an initial small-scale rollout or more broadly and permanently. Seek support and resources. Talk with leaders and coworkers to build buy-in and make sure the supplies, equipment, time, budgets, and human resources are possible and ready. Communicate the evidence you have collected and educate everyone who will be impacted. Make the information approachable using methods that work in your environment. Consider sharing journal articles for review and discussions with coworkers. Highlight the current problems and need for solutions. Open communication can build excitement and understanding and provide good input you haven't considered. Keep the plan organized and manageable. Don't rush it. You don't want to sabotage the results by racing to a solution. It takes time to plan and implement well. Have you heard someone ask the following question when facing a challenge? How do you eat an elephant? We don't really want to eat an elephant, but the intended answer is one bite at a time. It highlights the truth that processes are more successful and digestible when we allow time for adjustments and small accomplishments along the way. The time you spend in planning can serve to minimize barriers and leverage things that could facilitate the plan. Resources are important. We all know that resources aren't limitless. We have budgets. Plan to get the most value. Aim for the best return on investment, the best outcomes for the least cost. This includes time and financial considerations. Look for creative ways to use resources. Where are resources wasted? Can you reallocate to more useful and valuable efforts? Within any organization, there are systems that may make changes easier or more difficult. Assess what systems could influence your plan. How can your plan work within those systems? Could it be possible to improve a current system as part of your plan? This is another reason it can be helpful to collaborate with a team and leadership. Within work groups and teams, there are many individual personalities and ideas. This can be both a barrier and a facilitator. Ultimately, the diversity of backgrounds and ideas can allow you to explore the options more fully in the planning process. You need both those who may be critical of the plan and those who promote it initially. Setting respectful behavior standards and ground rules for group interactions are always good starting points. Win over your practice team with objective evidence instead of just personal opinions. By cultural barriers and facilitators, we mean the organizational or environmental context, instead of the individual characteristics we just mentioned. There are elements in an organizational or environmental culture that can be both barriers and facilitators. Assessment and awareness of unspoken expectations, values, habits, and rituals can facilitate the plan. We have already touched on the importance of measurement in identifying the problem and setting goals. Let's look at this in a little bit more detail now. The measurements collected before starting the project or implementing the plan are baseline measurements. They tell us about the situation when we started. Process measurements can include continual or intermittent reassessment of the baseline measures during the implementation process. These could be weekly, monthly, quarterly, or after each step in a series of interventions is completed. For example, you're trying to improve consistency of developmental screening in children. Baseline measures might include national or local incidence rates for specific developmental disorders, current access and utilization of developmental screenings, knowledge assessments of both healthcare providers and clients. Process measurements can also include assessments or audits of how consistently new behaviors and processes are being done. As an example, your plan includes educating parents and healthcare providers and providing access to screening. Process measures would include audits of how many parents are receiving education and whether screenings are completed as suggested. Outcome measures should match or reflect the baseline measures. Have the goals been achieved? Have the outcomes improved? Have incidence rates changed? Have practices changed or knowledge levels increased? As mentioned before, expenses or return on investment may be part of your baseline and outcome measures. Have costs been reduced? Has value been gained in other ways? For example, with early developmental screening, do clients have less health complications? Are developmental targets achieved more quickly? The investment in the new practices may create value by minimizing or reducing related costs. Charts and tables are always great ways to communicate data over time. They allow everyone to see changes clearly. When you have a solid plan based on the best evidence, it's time to make sure you have all the necessary support and approval for implementation. You will find that strong evidence from your literature search and appraisal will go a long way in getting support and approval. It's hard not to support things that have been proven to work well for clients and clinicians. Your team should be in agreement based on the evidence, but you also want the buy-in of a broader group of your peers and colleagues. Your organization may have professional governance committees or councils. Contact the chairpersons and present your plan for their input and approval. If you don't have a professional governance structure, you can still share at staff meetings or department huddles. As we mentioned before, unit and organizational leadership have awareness and responsibility for resources and a broader organizational issues. Their approval will be needed to support implementation as well. This should not be a big barrier if you have had leadership input on your team from the beginning. Make sure you share your plan and get the level of approval needed. Is there any chance your plan might be research instead of simply applying valid and reliable evidence in your environment? Did your review of the literature show that the parts of your plan have already been tested and are safe and helpful? If you are simply applying reliable research evidence or expertise in your plan, it does not require IRB or Institutional Review Board approval. The risk to patients and staff would not be greater than the current practices. In fact, the risk should be lower based on the evidence. This is what we define as evidence-based quality improvement. If you did not find evidence for your question in your search, you might be considering research. Research involves testing new practices to create new generalizable knowledge. There could be risks to consider for either the client or staff. This type of plan needs to be carefully considered before proceeding. Does your organization have someone with research experience, an IRB, or maybe an academic partner? These persons could help you know and prepare if research and human subject protection is needed. You have accomplished a job worthy of celebration to get to this point. You'll find it was worth the effort. Implementation is much smoother with all the evidence in planning. It is often best to do a rollout in a limited area rather than launching to a whole organization at first. These smaller scale rollouts allow for fine-tuning and more success in the long term. Always thoroughly educate and inform groups that will be using the new practices to avoid confusion or inconsistencies. Plan for your project team, other leaders, and resource persons to be readily available and supportive as you begin the new practice or plan. It takes extra support to help peers and colleagues feel comfortable with the new way of doing things. The tendency for all of us is to revert back to our old and comfortable ways unless we have understanding, support, and motivation. Remember, individual face-to-face conversation is still a really effective way to encourage and support change. Virtual connections are the next best thing, allowing the team to connect in virtual meetings or even in a professional messaging platform. Try to think of fun ways to encourage the group participating in the changes. Can you plan for a contest or for feedback opportunities? Including food always seems to be a good encourager. Healthy food, of course. As we mentioned, there may be a few bumps and surprises as you navigate implementation. Stay alert and problem solve with the work group. Usually minor adjustments are all that is needed when you've done a thorough planning process. You may even see some unexpected positive benefits. If something more serious comes up, you can certainly pause temporarily to make sure everyone is safe. Don't forget, you're not done assessing and measuring. This is the study part of the PDSA process and the knowledge to action framework. You may already be more familiar with performance management systems, which focus on assessing and supporting change processes and goals. In this phase, you're collecting your own evidence in the evidence-based process. Don't wait, start observing and measuring both during implementation and after. Observe the process and practice. How are things flowing? How are people reacting? Are you finding some barriers? What things are helping or facilitating the implementation? Watch for anything unexpected, either positive or negative. Measure for progress. Use surveys for opinions of those involved. Anonymous options allow for more open feedback. Patient and staff satisfaction surveys are often available or possible. Use audits. Both observation and audits will help document compliance with the plan. Develop audit tools with consistent items and scoring. Assign auditors and get permission to observe and access data. Health outcomes are very important measures, but can take more time to collect. It may take weeks or months to follow up on some processes and outcomes. It may take further review or use of dashboards and databases available in your organization. For example, if you need incidence rates, they may be available in dashboards monthly or quarterly. Work with managers and other leaders to track costs and expenses and to calculate the return on investment. As more and more of the evidence is gathered, Ask, are we achieving the goals? Remember the SMART goals? As we've mentioned before, everyone involved will be adapting their practice. You may also need to adapt the plan based on observations and measures. If so, communicate the observations and measures well to everyone involved. Bulletin boards, messages, personal conversations, or reports in staff meetings may be helpful ways to communicate results and adjustments. You may have other methods of communication that work for your team. Don't forget the evidence. You may need to go look for more ideas and information through additional literature searching. When you get to the point that all is working well, it's time to make the practice permanent or even extend it to a larger part of your organization. Occasionally, the evidence and plan simply doesn't work in a context or organization. If no amount of adaptation will work, if it takes excessive time and resources or causes more risk, the plan should be abandoned. This doesn't happen very often when you follow this evidence-based process, but be aware that it can. It can be a challenge to sustain and grow a new practice. I'm sure you've experienced the flavor of the month phenomenon before. That's when something only lasts for a short time, and as soon as you focus attention on something else, it disappears. When you have carefully implemented something with positive outcomes, you don't want it to disappear. There are some ways your team can help sustain and grow the practice. Keep supporting, asking for feedback, and auditing to make sure it is still working. Keep sharing the results and benefits in the months ahead. If barriers arise, make adjustments. If you haven't already written a permanent policy, procedure, or protocol, make it official in your system. Tell other departments about your successes, share at conferences, or write an article to help others outside your organization. Those who have done the translation process find there is a unique rush or feeling of joy, energy, and accomplishment that comes from translating evidence into practice. You can translate evidence on a small scale in your interactions with individual clients or on a department or organizational scale. But when you see the evidence help you jump the barriers and bring solutions and better outcomes, it's an exhilarating experience. When you have translated the evidence, you have investigated, collaborated, innovated, navigated obstacles, improved practice, and even discovered what doesn't work. It's all part of the process. Identify the next challenge. It's rather addictive in a good way.